Welcome to I'm Spiritual Dammit. I'm your host, Jenniffer Weigel, where each week we have a conversation about spirituality and thinking outside of the box, but also the whole sort of metaphysical paranormal, but it's not too woo-woo. Let me repeat that. Today's topic, not on the woo-woo train. We are with medical doctor Dr. Joshi. Now, Jay is the CEO and the medical director of the National Pain Centers. I am thrilled to have Jay in the studio because, Jay, you and I met when I was doing a show at the Wilmette Theater. I was interviewing Billy Corgan for the Smashing Pumpkins, and you said to me, hey, I'm a doctor, and I also believe that our emotions can actually affect our physical health. And I was like, ding, 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 we will be friends. So welcome to the studio, and I'm Spiritual Dammit. Thanks for being here, Jay.
Thank you for having me.
So since we spoke last, now we went and got coffee together, which lasted, 2 hours, where we covered everything from the world in, healthcare, medicine, doctors, pain, how we're not exactly always getting the medication we think we're getting. I mean, it runs the gamut. So right now, tell me, Jay, in your world as the medical director for the National Pain Centers, what are some of the through lines that you see for people with their pain in regards to their emotional and spiritual well-being?
It's a great question, and that was actually one of the longest cups of coffee in the world.
I think a panini was involved too.
It was a panini and some water because I don't even drink coffee.
Right.
So a big long glass of water. Pain management in the pain world is such a large topic, and a topic that is largely misunderstood because you have two sides of the pendulum. You have this one side that is increasingly more popular in the media, which is pain management and medications and pain doctors and pain patients. They're all kind of really not very great people or great therapies or whatnot, because you've had some really high publicized cases of bad people doing bad things.
Sure.
And the unfortunate part of that is everyone is lumped that whole category into that side of the pendulum. Then you have the other side of the pendulum, which is equally not good, which is over-prescribing or over-medicating or over-treating or over-utilization of the system. And throughout it all, it seems like that whole discussion about the mind and body connection is being missed. All we keep talking about is either how no medication should be prescribed and no treatments should be done, or the flip side, which is throw everything at them. And the reality is somewhere in the middle.
Sure.
The options are somewhere in the middle. I mean, all options are valid in certain situations. But again, when we talk about these options in Western medicine, we completely leave out things like, even simple things like sleep. We call it sleep hygiene. Right. Having proper protocols for sleeping. Nobody really talks about that. Unfortunately, when you have a patient coming in with chronic pain, they say, okay, what medication should we prescribe, or what procedure should we do? Or worst case scenario, this is what we see not infrequently, where they'll go to a primary care provider who really means well, but because you have absolutely no formal training in pain management in any of the 172 medical schools that are in America today, they don't know what to do with that patient. So they do what they've seen or heard, or what they've maybe read about, or they heard about in some conference that they went to. And in many situations, that is a referral to a surgeon. Now, the surgeon has been trained to do surgery, and so he's going to look at the patient from a surgical standpoint and either say, hey, no surgery or surgery. But again, throughout that whole process, where have we talked about simple conservative options?
Are you getting sleep? Are you stressed? Do you have food allergies? Any of these things. This isn't happening. They're just scanning them for the pain and going, yeah, that looks a little out of whack. Let's do surgery.
We don't see it happening as much as it should.
Right.
Simple things like, tell me about your life. Who are you?
Right.
We don't even see that.
There's no bedside manner. There's no conversation. Right? It's not taught in medical school.
It's not taught in med school, but what's happening more and more now is it's not even the fact of whether they've been trained or not, because some of them have been trained, and some of the a lot of physicians are really they've gone into it for the right reasons. Right. They really want to help the patient, and it has nothing to do with that now. It has to do with the fact that the majority of healthcare is now owned and guided by large business-based organizations. and their whole goal is to make a profit.
Right.
You know, it's understandable. They're a business. They have shareholders. But when you want to turn a profit, and with declining reimbursements and with Medicare cuts over and over, because Medicare is essentially an insolvent, bankrupt system that's borrowing in the future for current payments,
right.
You can't expect them to pay more. They don't have money to pay you now to begin with. It's very similar to the Social Security problem that we have, or many of the other government problems that we have. So the only way you can turn a profit is by doing a lot of things, or by spending essentially 3 minutes per patient as a provider, which is totally not what healthcare is about. In those 3 minutes, you don't even have time to do your note, much less ask the patient, so who are you?
Right.
Tell me about you. Tell me about your family. Tell me about your home dynamics. Tell me about your sleep. What do you do for a living? Tell me about how you think. What are your goals?
Right.
None of that stuff. It's essentially, you come in there and say, okay, you know, I saw your MRI and I think you need surgery. Or I saw your MRI and I think you need this. Or there's a referral for physical therapy.
Right.